I'm Dr. Luz Fonacier, President of the American College of Allergy, Asthma, and Immunology. This video will focus on best practices for conducting a telehealth visit with a patient of color who suffers from atopic dermatitis. I am joined here today by Dr. Tania Elliott, an allergist and a leading expert in best practices in telehealth and how to conduct productive telehealth appointments.
Thanks, Dr. Fonacier. We know there can be challenges in diagnosing atopic dermatitis in skin of color because the same condition can look very different in white skin and skin of color. So we're about to share some tips with you on how to properly diagnose and manage atopic dermatitis in skin of color through a telehealth visit.
Let's start with some specific tips that can help get the visit off to a good start. Ask the patient to send pictures in advance. Doing that allows the physician to zoom in and look at the skin more closely for redness, bumps around hair follicles, thinning of the skin that could be effects of chronic topical corticosteroid treatment. Face, hands, and feet tell the story. Involvement of those areas are associated with worse quality of life. Try to be more specific and standardize the degree of pruritus or itching. It's helpful to ask a patient, like on a scale of 1 to 10, 1 the mildest, 10 the worst, 8 keeps you up at night, what is your maximum itch during the previous 24 hours? We use this scale, but you can find any one of your own to use.
Now, it's also important to recognize that a telemedicine visit is different from your typical in-person visit, and the workflow may be different. And so while telemedicine can be a great way to see patients, there is a little bit of pre-visit work that might need to take place. And that would often require identifying a physician champion or somebody in the practice who assures that doctors are comfortable with physical examination techniques and history taking and shared decision making through this modality. And also a practice manager who's dedicated to coordinating and operationalizing telemedicine visits. Everything from scheduling that visit type and having an online offering for booking for a virtual visit, and that can be both for a new patient or for your established patients. And then also making sure that you have materials for the patients themselves on what to expect so that you're not fumbling on visit day with the patient not knowing how to use the technology or a camera. And remember that if you are intending to do a full body evaluation and examination, there may be some value in actually recording a pre-video for patients with some education around what to expect and how to do this. And you may want to section it off in parts and, also taking into consideration patient privacy and comfort level and thinking through some of those things in advance. Letting the patient know that they should be in a private area. Making sure you let the patients know that they should be wearing loose-fitting clothing because they may need to roll up a sleeve, for example, as the face, hands, and feet tell the story. Not wearing shoes or having their shoes off in advance of the visit. And there are a number of things. So what we would recommend is a pre-visit checklist for patients accompanied by a video so that the patients know exactly what to expect when they're going to be having this type of encounter. And it's helpful for the first time they're doing a virtual visit, but then also just as reminders for follow-up visits as you integrate virtual care into the routine way in which you deliver longitudinal care to your patients. Some other things to consider is if you're going to be evaluating hair-bearing skin, that may also take a little bit of finagling on the part of the patient, walking them through how to move the hair away from wherever it is that they're looking, and letting the patient know up front that it may take a little bit of time for you as a physician to get the exact right angle that they need. In addition, using the camera can be very powerful to take photos either in advance of the visit, as Dr. Fonacier said, during the visit, which is also a possibility, and then after visits to be able to evaluate treatment progress over time. So doing the communication technology-based services or a photo upload through a patient portal should be something that physicians are comfortable with and well-versed, as it could be a very useful additive to the way in which you treat patients and manage patients. If you have photos available to you, you can see patients' progress or lack of progress over time, and that can inform your treatment decisions much better than just our historical memory of what the patient looked like the last time they came in to see you in the office. The other thing that's important to recognize, particularly as it relates to skin of color, is that the lighting can change how light or dark something looks on camera. So you want to educate your patients on assuring that the lighting is consistent and the same each time you conduct the visit so that you're not skewed by just the lighting and how that might be reflecting off of the patient's skin, which is less of a problem in person. So it does require a little bit of education up front on the part of the patients and on the part of the doctors to know maybe that's just an overexposed image or an overexposed view or underexposed view, and that could be impacting the shadowing. And so you want to make sure that that doesn't impact your interpretation and making that right diagnosis in patients with skin of color. So remember, consistent lighting and ideally having the same background for the patient each time in a private area would be the ideal setup to conduct a video visit with your patient.
So, as you can see, diagnosing and treating atopic dermatitis in skin of color takes a bit of extra effort and knowledge, especially when conducting a telehealth visit. But with a bit of additional preparation, you can master the art of consulting remotely, and both you and your patients will have a more successful outcome.